5 health checkups you should avoid after 70 that may harm you more than help. Millions of seniors line up for routine medical tests every year, believing they are staying safe. But what if some of these so-called preventive tests are actually increasing your risk of complications, surgeries, or even cancer? Here's the hidden truth. New research reveals that up to 37% of medical tests in seniors lead to unnecessary treatments, complications, or lifelong side effects. And shockingly, 99% of adults over 70 are completely unaware they are being overtested. One of these tests, the number one on our list, is responsible for nearly 5% of all cancer cases in the U.S., the same risk level as drinking alcohol every single day. You won't hear this in the clinic. You won't see it on a billboard. But today, we're going to uncover it all. This video is your guide to the 5 health checkups that might do more harm than good. Real stories from seniors who faced serious complications and safer alternatives that actually protect your health. So before we dive in, let me ask you, where are you watching from? How old are you? Have you ever regretted a medical test or procedure? Do you feel seniors are overtested? Drop your answers in the comments. We read and reply to every single one with personalized advice. And don't forget to like, subscribe, and hit the notification bell. Your health is too valuable to leave to fear or routine. Let's start with number 5. Bone density scans, officially called DEXA scans, are often considered harmless. You walk in, lie down for a few minutes, and get a number showing your bone strength. But here's the problem. After age 70, these results almost always indicate lower bone density, even when there is no real fracture risk. This is because bone loss is a natural part of aging, just like wrinkles or gray hair. Many seniors are immediately prescribed medications called bisphosphonates, designed to strengthen bones. But these drugs carry significant side effects, such as jawbone necrosis, esophageal irritation, digestive problems, and even brittle bones that fracture in unusual ways. Studies show that in women over 70, bisphosphonates reduce fracture risk by only 0.3% over 5 years, a number so small it rarely justifies the potential harm. Take Rose, a 76-year-old retired piano teacher. Her DEXA scan showed osteopenia, and her doctor started her on medication. Within months, she developed reflux and jaw pain and could no longer play piano. By switching to a regimen of vitamin D, weight-bearing exercises, and a calcium-rich diet including sardines and leafy greens, Rose regained strength, balance, and mobility, and she experienced 0 fractures in the following year. The takeaway is clear. For healthy seniors without a history of falls or fractures, lifestyle interventions far outweigh the benefit of routine scans. Weight training, balance exercises, proper nutrition, and treating vitamin D deficiency can reduce fractures by over 20%, according to recent studies. Don't let a number on a screen scare you into medication you may not need. Memory lapses are common after 70, and it's natural to worry about dementia or Alzheimer's. Doctors often respond by ordering a brain MRI. These scans provide detailed images of the brain's structure, showing shrinkage or white matter changes. But here's the uncomfortable truth. These findings are almost always normal age-related changes and rarely indicate a treatable condition. The problem is what happens next. Once abnormalities are seen, seniors often panic. More tests are ordered, sometimes invasive procedures like spinal taps or biopsies, and fear escalates. A 2021 study reviewing over 3,000 MRIs in patients aged 70 to 85 found that 86% showed some abnormality, yet only 3% of these findings were clinically significant. That means 97% of seniors endured stress, worry, and unnecessary follow-ups for nothing. Consider George, 74, a retired engineer. He misplaced keys occasionally and forgot names, so his doctor sent him for an MRI. The results showed white matter spots, and George became convinced he had dementia. He stopped driving, stopped attending church, and his anxiety spiraled. After a proper cognitive screening test, simple, paper-based evaluation of memory and problem-solving. His score was normal. Through lifestyle interventions like hydration, proper sleep, and brain exercises, George stabilized his memory within months and regained confidence. The lesson: unless you have severe neurological symptoms such as seizures, rapid decline, or sudden personality changes, MRIs for mild forgetfulness are rarely helpful. Cognitive screening tests are safer, cheaper, and effective first steps that avoid unnecessary panic and invasive procedures. The cardiac stress test is one of the most common exams ordered for seniors who feel mild fatigue, occasional chest tightness, or just a decrease in energy. During the test, your heart is monitored while walking on a treadmill or receiving medications that mimic exercise. The goal is to detect blocked arteries before serious events occur. However, after 70, stress tests often do more harm than good. The accuracy drops, and false positives are alarmingly common, up to 40% in older adults. A false positive can set off a cascade of unnecessary procedures, from angiograms to stent placement, or even bypass surgery. These procedures carry real risks: bleeding, kidney damage from contrast dyes, infection, or prolonged hospitalization, without improving survival or quality of life. Consider Raymond, 75, a retired postman who walked daily and stayed active. During a routine checkup, he mentioned occasional fatigue on hills. His doctor ordered a stress test. The results were ambiguous, so he was sent for a catheterization where a minor narrowing was treated with a stent. That night, he suffered kidney complications from the contrast dye, spent 6 days in the hospital, and had weeks of follow-up care. His fatigue never improved because his heart wasn't the issue. It was simple dehydration and need for pacing activity. For seniors without clear heart symptoms like chest pain during exertion, shortness of breath, or extreme energy drops, safer options exist. A resting EKG checks heart rhythm without risk. Coronary calcium scans use minimal radiation to detect dangerous plaque. These approaches are simpler, safer, and far less likely to push seniors into unnecessary, high-risk procedures. Colonoscopy is considered the gold standard for colon cancer screening, but after age 70, and especially past 75, it's often unnecessary unless there are specific symptoms. The preparation alone is harsh, requiring strong laxatives that can cause dehydration, dizziness, or kidney problems. Sedation adds further risk, including temporary confusion or heart rhythm changes. The procedure itself carries the risk of bleeding, perforation, or infection. A large 2019 study following over 1.3 million Medicare patients aged 70 and older found that for every 1,000 colonoscopies in those over 75, only 2 lives were saved, but more than 20 suffered serious complications, a 10-to-1 risk-to-benefit ratio. Even when polyps are found, many grow slowly, and removal may cause more harm than benefit. Take Dana, 73, a grandmother and bakery owner. She had no symptoms and no family history of colon cancer, but her doctor recommended a routine colonoscopy. A small polyp was removed, but she collapsed afterward and was hospitalized for 9 days due to a bowel perforation. She lost weight, strength, and independence. For seniors in good health, non-invasive alternatives like the FIT stool test are much safer. It detects most concerning cancers without prep, sedation, or procedural risk. Ask your doctor whether a stool-based test or targeted screening is appropriate, because repeating colonoscopies unnecessarily can endanger your health rather than protect it. Full-body CT scans are the most overused and potentially harmful screening test for seniors. Often marketed as a preventive tool, these scans expose you to very high doses of ionizing radiation, between 10 to 20 millisieverts per scan, equivalent to roughly 500 chest X-rays. For adults over 70, the risks far outweigh any unproven benefits. Each scan can detect tiny nodules, calcifications, or cysts that are completely harmless, but once they appear on a report, the panic begins. Additional scans, biopsies, or even surgeries may follow, all of which carry serious risks, especially for older adults. Research suggests that full-body CT scans may account for up to 5% of all cancers in the United States, putting them on par with daily alcohol consumption as a cancer-causing factor. Consider Marcus, 80, an active former martial arts teacher. He participated in an executive health package that included a full-body scan. A tiny 3mm nodule was flagged. Over the next few weeks, he underwent PET scans, consultations, and a needle biopsy. The nodule was benign, but the biopsy caused partial lung collapse, hospitalization, and a 2-month recovery. All of this for something that never posed a risk. Experts, including the American College of Radiology, are clear. Full-body CT scans should never be used for routine screening in asymptomatic seniors. Targeted imaging is only appropriate if real symptoms are present. Listening to your body and maintaining regular checkups with your primary physician is far safer than chasing unnecessary scans. Modern medicine is powerful, but it's not perfect. Sometimes, less is more. Before agreeing to any test, always ask, what happens next? If this shows something abnormal, what's the plan? If the answer is unclear or the risks are higher than the reward, pause. Real prevention starts with lifestyle. Stay active with strength and balance exercises, eat nutrient-rich foods, get quality sleep, manage stress, and address vitamin deficiencies. These are proven ways to protect your health and reduce the risk of fractures, heart problems, or cognitive decline, without putting yourself in danger with unnecessary procedures. Now, we want to hear from you. Have you or a loved one experienced complications from a medical test that turned out to be unnecessary? Share your story in the comments. We read every single one. And don't forget to like, subscribe, and turn on notifications so you never miss a tip that could save your health and quality of life. Remember, your time, energy, and health are far too valuable to waste on fear-driven screening. Choose wisely, live fully, and stay healthy.